Lithium used in pregnancy and the risks of cardiac malformation. Definition: Lithium is a medication used to treat bipolar disorder, which is also called mechanical depression. Lithium may also be used to treat other psychiatric and medical conditions. Lithium is sold under many brand names such as Inglés, Scali, Litan, Litoid, and Litonate.
My favorite element is lithium. It's got 3 protons and either 3 or 4 neutrons in a stable configuration. I want to talk about lithium in bipolar disorder. It's an alkali metal, meaning it's only got 1 valence electron, which is easily donated to form the lithium ion. This is the same family that sodium and potassium are from, which are physiologically critical. It was formed in the Big Bang, and so you could say it is the ultimate natural medication. Pharmacokinetically, lithium is absorbed completely and rapidly in the gastrointestinal system. It is distributed throughout all the water in your body, and it is not metabolized because, of course, it is an element. It is excreted approximately 95% by the kidney. At the cellular level, it decreases excitatory neurotransmission by lowering levels of dopamine and glutamate. It increases inhibitory transmission by increasing GABA and serotonin levels. It also increases brain volume in the hippocampus, amygdala, and prefrontal lobes. You could say it is true brain food. At a clinical level, lithium is used to control mania. It also prevents relapse. It reduces suicidal drive in bipolar and unipolar depression, and it treats bipolar depression. Finally, it prevents bipolar-related cognitive decline. At a population level, we note that where there's high lithium in the water, there's less suicide and homicide, and the opposite for low lithium in water. This is a globally observed phenomenon. I love lithium.
Application in medicine. Lithium is used to treat and prevent episodes of mania, frantic abnormality, seizures in people with bipolar disorder. Many depressive disorders are diseases that cause episodes of depression, many episodes and other abnormal moods. Lithium is in class of medication called antihypnotic agents. It works by reducing abnormality activity in the brain. Pros and cons. Pros. Allow the stability of bipolar disorder and part of personality disorders. Cons. Maternal lithium use during the first trimester produces a cardiac malformation. There is an increased chance for heart defect in the lithium is used when the heart is forming during the first trimester. A very rare heart defect called Einstein anomaly has been seen in addition to other more common types of heart defect.
Mood disorders vs. personality disorders. Most people do not realize the difference between mood disorders and personality disorders. A mood is a state of mind. A personality is a combination of factors that make an individual who he is. This includes the feelings, thoughts, and actions of the individual. So, this highlights that there is a difference between a mood and a personality. With this basic comprehension, let us move on to a definition of mood disorders and personality disorders. Mood disorders are psychological conditions that bring about severe mood changes in individuals. Personality disorders are behaviors and thoughts of an individual that go against the cultural expectations of that particular society. Both mood and personality disorders encompass a number of disorders. Through this article, let us examine the differences between a mood and personality disorder. Personality disorders are behaviors and thoughts of an individual that go against the cultural expectations of that particular society. Personality disorders are more constant than mood disorders. According to the Diagnostic Statistical Manual, there are 10 personality disorders. They are:
USA applied in Ecuador. The treatment of pregnant women with mental illness created a dilemma created by the paucity of evidence on which to base to the principle of psychotropic during pregnancy. Is complicated by numerous factors including those of an ethical nature.
I'm not an expert in treating bipolar disorder in pregnancy, and I would drive women who are thinking about getting pregnant or who are pregnant and suffer from bipolar disorder. I would suggest they go to the websites Emory Women's Program, Emory, EMORY, Women's Program, .org, or to the website at Harvard, which is called manicdepressive.org, or to the healthyplace.com website. In each of these websites, there are references to using psychotics or mood stabilizing drugs during pregnancy. Drugs like lithium and Depakote have been shown that they may cause some fetal abnormalities and probably should be avoided. Other drugs, the atypical antipsychotics, may not cause as problems, but again, this is such a touchy area, and the